Hello and welcome back to Patient Knowledge. I'm Dr. Kirmani, and this channel is all about health education. Well, have you been noticing any alteration in your bowel habit? Do you pass blood in your stools, or have you got any pain in your tummy for a while? Do you know it could be sign of cancer colon? Well, there are some more signs that we need to look for. So let's get started and find out more about it. Have you been noticing any change in your bowel habits such as constipation or diarrhea for more than 3 to 4 weeks? Do you pass blood in your stools? Or have you noticed any blood on the toilet tissue? Have you been feeling constantly as if there is a bowel movement? Have you been passing narrow stools? Do you feel pain in your tummy? Or have you noticed any lump in your abdomen? Have you been having any unexplained anemia for a while? Or have you noticed any unexplained weight loss when you've not been trying to lose weight? Do you feel extremely tired and bloated all the time? Well, these are the signs that you could be having cancer colon. Well, how common is this cancer? How does it start? Is there any screening test available? Who is at risk? Why is it important to get screened for colon cancer? And can bowel cancer be prevented? What are the risk factors? How can it be diagnosed? And what's the treatment available? Well, you will get answers to all these questions in this video, so stay tuned. How does it begin? This cancer starts as a small growth arising from the inner lining of the gut in the distal part of the gut called as the colon, or sometimes towards the end part of the gut called as the rectum. When it involves both the colon and the rectum, it's called as colorectal cancer, and it's commonly known as bowel cancer. Initially, it does not produce any symptoms, so the person may not be aware that they've got a growth inside. It can spread in the adjacent structures and can travel through circulation and affect the other organs of the body. It can go up to the prostate gland in men and can invade the womb in women. Well, it does not have any symptoms initially. It's hard to know if you have cancer, and that's why doctors recommend to get a screening test done for high-risk individuals who are more than 50 years. Here's a checklist of risk factors. So look for them. If you have any of these, you fall in the high risk category. If you have a family history, that is first degree relative, if you have got a history of cancer of colon, rectum or ovary, if you have a history of high risk adenomas, have got any inherited changes in certain genes, if you've been suffering from inflammatory bowel disease such as ulcerative colitis or Crohn's disease for more than 8 years, and of course your lifestyle. Have you been smoking, drinking more than 3 alcoholic drinks per day? If you're obese, and also the age. It's no longer a disease of the middle or old age. It's also been reported in people who are as young as 30 years. This is because of change in the dietary habits. More and more people are eating fatty food and food that is less in fiber. So if you come in the high risk group or you've got any of the above symptoms, it's time to book an appointment with your doctor. Now, what will your doctor do? We'll take a detailed history to evaluate your health condition. We'll perform a thorough physical examination to check for any lumps or unusual things. Might do a digital rectal examination where 2 fingers are passed through the back passage and check for any growth inside. And a screening test called as fecal occult blood testing is done. This is a simple and easy test where a sample of stool is placed on a card or in a container and sent for testing in the laboratory. This is examined under the microscope and they look for presence of any blood in your stools. If this screening test is negative, it should be repeated after 2 years. And if it comes as positive, further evaluation is required by more intense testing. It doesn't mean you have cancer. It just shows that there is something happening inside your gut which needs to be further evaluated. Now, the doctors may perform sigmoidoscopy or colonoscopy and biopsy. Well, this is also a procedure where a long, thin tube is passed through the back passage. This tube has got a camera, a light, and a wire with a cutting loop to visualize your gut, the lower part. And if the doctors find any growth, they can take a sample and send it for testing. Well, what happens if the test comes as positive? It means that you have cancer, and the treatment depends upon the spread of the disease and your general health. Well, the doctors will have a treatment plan which usually consists of surgery, radiotherapy, and chemotherapy. The surgery is usually performed to remove the nasty growth from the body, and this is easy, can be done by the modern techniques such as keyhole surgery, where the recovery is usually early. Radiotherapy is a procedure where special rays are passed onto that part of the gut to destroy any remaining cancer cells. And chemotherapy is usually done by giving some medicine directly into the circulation to look for or to take care of any spilled cancer cells in the circulation. This is followed up by regular checkups every 6 months to keep an eye if the cancer cell is coming back. Well, the prognosis depends upon the stage of the cancer, whether the cancer has caused any damage to the gut, such as any blockage or made any hole in the gut, whether any cancer cells left after surgery, whether the cancer has recurred, and also the general health of the patient. Well, the question is, can bowel cancer be prevented? And the good news is, yes, it can be prevented by just bringing about lifestyle modification. Eating a healthy diet. Avoid any fatty food, any food that is processed or packaged. Instead, go for fresh food, fruits, vegetables, and plenty of fluids. Exercising is a good idea. Having an active lifestyle is always good for health. It is good for mind and body. So practice any activities such as walking 30 minutes a day would be ideal. People who are smoking need to consider quitting smoking. Drinking in moderation is advisable. 2 standard drinks per day for men and 1 for women is the safe level of drinking, and at least 2 to 3 days free of alcohol is recommended. Now for sleep, it's good to have adequate 8 hours of sleep for a sound body and mind. If you are under stress, practice relaxation techniques such as yoga and meditation. Well, by recognizing the risk factors, adapting a healthy lifestyle, going for a screening test, and contacting your doctor at the right time, you can prevent colon cancer, or at least you can have a better outcome with early intervention. Well, that's all for today. I hope this information was useful in understanding the importance of screening, identifying the risk factors, and listening to your body in case you have any symptoms. Thank you for listening. If you wish to hear something, leave it in the comment box below. If you like my video, like, share, and subscribe to my channel. Bye for now.